So I'm going to be talking about the radiologic technology program. So this is radiographers, computed tomography technologists, MRI, mammography, interventional, cath lab technologists. There's a large number of modalities and areas that radiographers can actually work in once they graduate. So if you don't mind changing for me. Okay, so what do? So we take images, whether it's a CT scan or we take an x-ray, if you've ever had an x-ray before, but we basically use radiation to create images of the body. The radiation goes through the patient, goes to an image receptor that detects the information, and then it sends it to a computer, you know, in our latest technology. So we get to see what's inside the body with radiation. Okay. So this is some information on a career profile. It probably make this an hour and a half long if we went through all of these. So I'm not going to go through all of these videos. But what is a day in the life of a radiologic technologist? So if you're working in an x-ray department, you might be working in an area where you're doing what we call bariomenemas. You might be doing upper GIs and working with physicians doing that. You might be in the surgery suite. You might be in the emergency room taking x-rays of individuals that have come in through the ER. You might be in the regular diagnostic department taking x-rays of inpatients and outpatients. You might work in a doctor's office taking x-rays. You might work in an urgent care center. There's just so many different areas that you might work in as a radiologic technologist. CT technologist as well. They work in ERs, they work in diagnostic departments, they work in surgery. For years, we didn't have portable CTs, now we do. So you might be going up to the ICU to do a CT scan of a patient's head, their brain, or you might work actually on a mobile unit. There's actually one here in the city of Toledo area that actually does CT scans of stroke patients right in an ambulance. So it's kind of a cool thing. So, okay. So looking at the industry outlook, according to the Bureau, the current statistics are that it's expected to grow about 9% over the next 10 years. And that growth is actually, again, above average for other occupations. So you can see the mean hourly wage, $29.59, and this does vary if you work in a doctor's office versus the hospital. And most of the time, the hospitals do pay higher wage. Now, individuals who take calls, so for some, if you are going to work in a cath lab or if you're working in an interventional area, if you are working in CT, there's a possibility that you could be on call for the hospital, and there's always an opportunity to make more money that way. And then, of course, as a starting technologist, you would actually make, you know, less than this. So this is more on an average based on all of the different areas that an individual can work. Okay. All right, so where do they work? We talked about this just a little bit. They work in the department, fluoroscopy, surgery, ER, patient care rooms, going up and doing what we call portable exams, actually going to the patient to ICUs and CCUs and neonatal ICUs. We also work in physicians' offices, outpatient care centers, urgent care centers, commonly hire radiographers and CT technologists, mobile vans. Some individuals I know work for equipment sales. Other ones I know are PACS administrators. So those are some of the many things that you can do with this degree. Okay, so what does it take? What kind of characteristics would you need as a radiographer? Detail oriented, there's going to be a lot of information you need to know about the equipment. You need to have an understanding of your equipment and how it works and how to take care of an issue. If the equipment isn't working right, how do you fix it? So not that you're taking apart equipment, you could become and work on equipment or repair, but the majority of us need to be a little troubleshooters, of course, with that. But we also have to pay attention to detail. So we have to remember to put a lead shield on our patients. We have to remember to ask about chance of pregnancy. We have to remember about where the centering needs to be. We need to know our anatomy really well in order to know exactly where to position and how to position a patient for the exams. We need to make sure that we are not making mistakes and doing things in specific orders. And we teach our students exactly, kind of go in this order, find your little order to do things in so that you don't forget important little details, like remembering to put an image receptor in the table. So sometimes we have to do that, and we need to make sure we're doing the right patient, we're doing the right patient exam. So all of those have to be checked and double checked. We have to be good teamwork. So a lot of times we'll be doing exams where we really need more than one of us to lift the patient and do, especially portable exams and emergency room patients and ICU patients, et cetera. We work together as teams. If you're gonna work in a cardiac cath labs or an interventional lab doing specialty exams, you're gonna be working with a physician and a team of individuals, including other healthcare professionals such as nurses in that environment, and you need to work together. You need to have stress management. You're going to be working in situations like going into the OR and performing exams there, and you're going to have a whole team of individuals kind of waiting on you to perform that exam so they can move on. And you're also going to have frightened patients. You're going to have injured patients. You're going to have individuals who aren't sure, and you need to be reassuring while you're actually doing your exam and kind of dealing not only with the equipment, but also you're working with patients. Is one of the things I love so much about this field is we get a chance to have to know the technical side and the patient care side of it. That's what excited me about this field, is kind of having that combination of that. I always like to know how things work, but I also loved working with people. So both of those need to have a balance. You need to have integrity. There will be a lot of things that no one would know if you didn't put that shield on the patient, but it needs to happen, and we need to remember to do it. So we need to have integrity and set proper technical factors so we keep that radiation exposure as low as possible. We need physical stamina. We have to be able to lift patients and move patients around. You're going to be standing on your feet for 8, 9, and 10-hour days, depending on your shift. You might only work 4 or 5 hours, but most radiographers are working 8 to 10 and even 12-hour days, and they're on their feet that whole time. Need to be flexible. You might go, as I mentioned earlier, you might go to the OR and do a case, then you might go to the ER and do a case, then you're going over to fluoroscopy and assisting with a case there. So you're going all different areas, and being able to be flexible is really important as a radiographer. Okay, growth opportunities. This is kind of really what I talked about. One of the things I didn't mention is we do DEXA scans, we do bone densitometry examinations. Mammography is actually a field that is in great need of imagers. That is the field that actually has a lot of positions available. So it is a specialty. Individuals have to go on and get additional training. It's always on the job training. And then you have to pass an additional certification exam. So there are laws on that and who can actually perform. You have to perform so many per year. So really that's an area where we especially need individuals going into the field. That's where a lot of jobs have been coming available, especially in mammography. What do we do? Some things I think that surprise individuals is we start IVs. We actually inject medications. We give oral medications, oral contrast media. It doesn't taste so great, so the patients don't always like drinking it. So we have to explain to the patient, be good at our patient care and our patient care duties. We have to practice radiation safety. It is important because we are the ones that actually set those technical factors. And we communicate a lot with other healthcare professionals. We work side by side with physicians and nurses and other medical imagers. So all the time, we have to be prepared to be able to perform CPR. I've had to do it myself as a radiographer. So we have to know how to do it in case our patient has an issue. We do patient billing. We have to understand patient coding in order to create the bills for the examinations. We might be the schedulers. We have to be able to demonstrate how equipment works. And as I mentioned before, we could be selling equipment or we could be PACS administrators. And those are the individuals who are actually in charge of the images that are created by the program itself. Okay, so one of the things some of the awesome things about being a radiographer, there's never a dull moment. The day goes fast. You'll be amazed. There's rarely a downtime. So it's really cool to take those images and then see what they look like. And it's really great. You get to work with patients, and that's just a wonderful part of this field. If you love moving, you don't like sitting still, you love to talk to other people, you get to work with a number of different patients. You might have one patient for 2 or 3 minutes and then have another patient for a half an hour, but you're gonna be switching patients constantly. And you wanna be a healthcare professional, and you want choices of where you can work and what you might do in one day. You do lots of different things, so it's pretty cool. Okay, so for the selective admissions, I know that Misha's going to go over this, but we just mentioned that we do take 40 students per year in our program. So we do take quite a few students. We don't have a waiting list. So it is selective admissions. So those individuals who get the top points are actually accepted. So the top 40 point earners. So, all right. So you will be having, so for your classes, I'm not going to spend a lot of time on this because this is, but you will be required to put in additional time. So on average, in addition to your lecture times, and you'll be attending lab, you go to clinical. We start our clinicals in the first year. Our students go through an 8-week course, and then starting their very second course, they're already going to clinic 2 days a week. You'll go to clinic 2 days a week in your first year and 3 days a week in your second year. So you are very busy, especially the first year. We tell our students that working full-time may be very difficult, especially in your first year, and even working a lot of part-time hours. So there is a little more time in your schedule in your second year because you're in your first year, you're also required to come and practice in our labs. And in those labs, you need to kind of get an idea of how to position the patient and what technical factors to set. There's a lot to learn there, and that, again, you can't do that at home. You need to come to our labs to do it. So there's a minimum of 1 to 2 and sometimes 3 and 4 hours a week. On average, it's only 1 to 2 additional hours per week that you'll actually physically, in addition to your lab lectures and clinicals, be on campus and doing some practice in our labs. So we do have small class sizes, and you can go ahead and skip through this, but we are going to be doing some of our classes for summer and for fall online, and some of them, of course, you need to practice. So we are having students come to lab starting this summer, and they will be practicing and doing that. So as I kind of did all of this already, I did want to mention that there is another thing that you can do if you are interested in it. If you've ever heard of like a nurse practitioner or a physician's assistant. So those individuals, actually you can become a radiologist assistant. It is an additional master's degree for an individual, so you'd have to go back finish up, take your associate's degree that you would get here in the program, you would move on to getting a bachelor's, and then you would need to get a master's to become a radiologist assistant, and you'd actually perform more examinations than a radiographer is able to, an even wider scope of practice. So do you mind, Amber, just going really quick back to the lab ones? I just wanted to show some lab pictures, if you don't mind.
Yep, absolutely.
So these are our labs here. We are really blessed at Owens to have some very up-to-date equipment. We have, this is a room we call a CR room. We have this, this is 404, so that, but it does have digital detectors that we can take and create digital images. And then there should be for the other two pieces of equipment. And then this is what the CR equipment looks like. Go ahead and switch to the next one, please. This is 409, is an all digital. That little blue handle that you see is actually a detector. We don't have to take anything in and out in this room. It actually sends all the information to a computer, so which is really cool. Is there a portable picture in this one? That's our screen. Yeah, we have a brand new portable in our department we are just super excited about. So it is all digital, so it has a digital detector. We can even take images off of it, so it's really cool. We're super excited about utilizing our new portable. So this is a brand new, this is at the hospital, you take it to ER or to ICU or up to a patient room and do the images there. So it's kind of like a little mini x-ray machine. Doesn't look so mini, does it? But that's about as small as we get right now for x-ray machines. Thank you. So the last thing I would like to say is that we do have a 100% job placement. For the last 3 years, our students have gotten contingency jobs. Some have gotten full-time. Some went right into CT. They did the CT certificate at the same time and got jobs right into the into a CT department straight out of X-ray school. So that's pretty awesome. And so that we have been able to, you know, have individuals get jobs. So, thank you.